Hey guys, well, I'm going to start right now. So thanks for tuning in. I'm glad there's some people here. We were really recording this, as I said before, for social media, for some information on arm care. I'm glad to see so many people tuned in. It's really, really encouraging to see some people with forward thinking on arm care. My name is Nunzio Signore. I own and operate Rockland Peak Performance along with my partner, Bahram Shirazi. And we're going to talk, Bahram mentioned to me the other day, man, we get so many questions on arm care. I just, people always ask me, how much arm care do we do? How much arm care is necessary? So he said, why don't we do a podcast? I mean, a Zoom call on arm care. So this is what this is. And like I said before, let's run it like a forum. If you have questions, please don't hesitate to just click in and say, hey, Nuns, my name is so and so. This is what we want to do. So uh, in the next in the next 30, 40 minutes, we're going to talk about why arm care, what's involved in it, training tips, the big five of any arm care program that you should look if you are training and your son or daughter is in an arm care program. These are some of the big five that any arm care program should include. We're going to talk a little bit about strength training, not so much, but some necessary strength training as far as arm care goes, because it is not one dimensional. Um, we're going to talk a little bit about pre and post throw routines. So why arm care? Well, for number one, it helps prevent injuries. And I can't tell you how many of our young guys, especially the 13-year-olds, once they start to get to the big field and they start to throw, uh, all of a sudden the elbow is bothering them, the shoulder is bothering them, and they've probably. I'm willing to bet that there hasn't been a lot of arm care introduced into their program even at a young age. So the answer to the question is, do you do arm care at a young age as well? 100%, absolutely. The volume of it is a little different than an older person, and like maybe a high school athlete. So we're going to get into that as well, uh, to prepare them for their game, for their performance. you know, 20 minutes of arm care before a guy hits the mound, 20 minutes of arm care before a position player hits the field. It can do wonders for actually glenohumeral movement, scapular stability. It can do wonders for guys to enable them to throw and perform at a higher level without actually doing any damage to the tissue. Maintaining the strength and flexibility. So we notice once our off-season programs end, the athletes that continue to train with us in season are getting the arm care that they need. And that's really important once in-season training starts, because the object of maintaining the strength and flexibility of the shoulder and the elbow are huge when they start playing baseball. And you got to remember, guys are starting to play baseball in March, and it's going April, May, and then summer starts June, July, August. And if you're choosing to play fall ball, that's September, October. We're talking about 6, 7 months of throwing. So maintaining their strength and flexibility and helping, keep that external rotation while maintaining good IR as well is huge for maintaining health and wellness of that shoulder. And that's brings me to number 4, which is maintaining overall health of their pitching arm, shoulder, and elbow. So some training tips. I'm giving you everything that I know about arm care and what has gone into the arm care program that we do with everyone in our facility from age 13 all the way up to pro guys. Okay. This is how we work arm care with our teams. This is how we work arm care with our individual athletes who are coming in from high school. This is how we work at arm care with our college guys and our pro guys. So when we're talking about arm strength and endurance, it's not just about strengthening the shoulder and the elbow individually. We have to look at the movement as a whole, right? Drill specificity, identify the type of mover. So When I say identify the type of mover, that is many young kids who are still going through growth spurts. They have a lot of laxity, loose joints. You can see the kid walk in. Some of them are tall. They've hit their growth spurt early. Some of them are short, but regardless, they're kind of like Gumby. They don't know what to do with this body. They've got this body and they're trying to figure it out. And they have a lot of what we call laxity, which is allowing the joints to go through passive restraint, past the passive restraint that it wants to. Okay. Then we have other kids who grew really fast and they're inherently tight. Okay. And they're more tighter movers. So the type of arm care that you give a kid who's really loose and the type of arm care that you give a kid who's really tight are two separate entities. And we're going to talk a little bit about that. Addressing the big five, we're going to talk about that. And strength training, increasing the resilience and the durability. Putting muscle on a young athlete's body is like putting shock absorbers on their body. When the lead leg comes down the mound and hits, when a shortstop cuts to his right, bends over, grabs, and has to stop and go the other way, this requires a lot of lower body strength. It's not just about upper body strength. So we have to address strength training and increasing the resilience and the durability. Arm stress, throwing mechanics, and managing volume. We need to make sure that our guys are throwing enough to actually get their arm used to the residual stress of throwing. And we need to make sure that we're not overdoing it, where we're creating too much volume. And this is especially important with our young athletes that are 13, 14, and 15 who haven't really developed that training age and that muscle on their body to be able to create those passive restraints. So we need to be careful as to how much we are giving young athletes as far as volume of arm care. You can't just pile on arm care and hope, that it's doing the right thing, because too much of anything is not a good thing. So identifying the type of mover. For our tight guys who hit their best numbers in the third inning or so, extended warm-ups and stretching and activations are key. 20 minutes tops, okay, for our tight guys. For our loose guys, very little ground-based mobility work, mostly movement and stabilizations because they're loose. And you can notice it's 10 to 15 minutes. It's less than our tight guys. The tight guys need a little bit more movement. The loose guys need a little bit more stability. Like I said, if you've got questions, please let me know. Here's the big five in any arm care program. When I put our arm care program together for our teams, when I put our arm care program together for our clients or our pro guys or our college guys, it doesn't matter. It's all relative. It's just these are the five things that I really, really think about, okay? Proper breathing pattern, and we're going to go through these. Improving scapular stability, improving rotator cuff strength, and addressing the elbow, strengthening the flexor pronator mass, and thoracic spine mobility. So let's look at these one at a time. Proper breathing patterns. If we don't breathe through our diaphragm and instead breathe into our chests, the rib position displaces the scapula, leading to poor upward rotation. And this can create alignment problems and restrict mobility and increase the risk of shoulder impingement. What I mean by that is young athletes have a tendency to breathe from high anxiety. When I watch, the first thing we do in an assessment is we watch an athlete breathe. And if I see the diaphragm expanding, that's great. If I see the chest and the neck expanding while they breathe, that's generally a sign of high anxiety. And that is generally, just so you know, that is generally what I see in most 13 to 16-year-old kids. Okay. It's the world we live in. It's how they live. They're going through life. They're trying to figure it out. And they're chest and neck breathers. And by doing this and breathing through their chest, they're hiking their rib cage, they're elevating everything, and it makes it hard. Once the rib cage is elevated and the neck is tight, it makes it hard to get the arm efficiently overhead. What we need to do is we need to give them a proper breathing work. And this is something we do. This is called all four breathing. Okay. This is part of an arm care program. So this is huge for us as far as getting kids to breathe. When our kids come in and our guys and our athletes, like I said before, I'll say it a million times, whether they're 13 or 14 or 20, they're coming in and they're breathing. And it's very, very important to reset the rib cage before we do any other work. Because if we try to create mobility within this athlete's body before setting up the rib cage, we're shooting a cannon from a canoe.
Hey,
I have a
Nunzio,
question on that. Oh,
Great. I'll go back. Go ahead.
go ahead and then I'll ask mine.
No,
gotcha.
go ahead.
Thank you. My name is Mark. I'm from Columbus, Ohio. I'm about to be a physical therapist, and I was questioning if do you do like a hands-on assessment of breathing, looking for if it's like the diaphragm or we're looking into like the accessory muscles, like into the neck prior
Yeah,
to starting your exercise?
I do. So what I was saying was, great question. I look at the athlete from the side when they first come in. When an athlete comes in for an assessment, they take their shirt off, they take their shoes and socks off. We weigh them in, and then I have them stand statically. And I have them breathe, and I tell them to breathe for 5 seconds through their nose and 5 to 8 seconds through their mouth. And I have them relax. And what I do is I'm trying to look at this athlete statically in the most relaxed state that I can look at him in. And the first thing I look at is his breathing pattern. And if I see chest and neck, I'm there. If I see no chest and neck, I will now go behind him and I will see if I'm getting posterior expansion out or am I getting posterior expansion up. If I'm getting posterior expansion up, that is something we need to address. If I'm getting it out, then this guy's breathing. But I will tell you, Mark, from 13 to 17 years old, maybe 1 out of 10 guys are breathing correctly. And you probably know what I'm saying.
Yeah,
So,
I see it a lot as well from that age. So I was curious on how your like your eval goes if you're from the lateral to the posterior side. So thank you.
yeah, I look lateral and then I go posterior. If I see nothing lateral, I go posterior. We also measure ISA. We're not going to get into that today, but we also look at the infrasternal angle with our older guys, not with our younger guys. Who else had a question?
Jim in Albany, Nunzio.
Hey, Jim.
How you doing? Some cues or I wouldn't be able to tell other than what you just said if the rib cage is rising or if I'm behind them, if they're breathing from their chest or their diaphragm. So how are we supposed to determine that, I guess?
The best way to determine that is get an assessment from somebody like Mark, who's in tune with that, a
Okay.
physical therapist or a facility that does that. Unfortunately, there's not a lot of them.
Right.
We are one of them. We're 2 hours from you. So, I mean,
Yeah.
a lot of guys, and I'm going to tell you, I have a lot of guys that travel. I have people that travel from Cleveland, Ohio to get assessments. Because once you get that assessment, we can certainly send that to a physical therapist like Mark, or we can certainly send that to a strength and conditioning coach in your area with a program that he can do. So,
Okay.
so for you in Albany, honestly, it seems like you're far away, but you're one of the close guys.
Yeah.
We have people get on airplanes and come to us to get an
Yeah.
assessment.
We've been down to you before. I brought my kid down to you. So
Oh,
yeah,
great,
it's
great, great. Yeah,
worth it. I understand.
yeah, that's what I would do. Awesome. Any
Thank
other
you.
questions? So, improving scapular stability. So, the scapula has to be in the right position and provide a strong, stable base of support for the rotator cuff muscles to function properly and help maintain ball and socket congruency. And when I say ball and socket congruency, a lot of people ask me a lot of times, what is the purpose of training overhead athletes? And what is your if you had to tell me one thing about your facility, what would it be that helps you create better performers with less injury? And I will tell you, keeping the ball in the socket. And that's really, that's gold right there. That's the golden ticket. And when the scapula is not stable and it moves around, the ball of the humerus cannot stay congruent in the socket. And when that can't happen, we start bumping up here, we start bumping up here, we start going over here, and all of a sudden we get inflammation. And then inflammation turns into fraying. And then fraying turns into a tear. And I liken it to a credit card. When you don't have good scapular stability and this is moving around, you're creasing that credit card. He might have some soreness, your kid. He might have some soreness, but the ATM machine still works when you put the credit card in. But if you keep creasing that credit card and creasing it, one day you go to the machine, it's too creased, it either cracks in half or it doesn't work anymore. And that's what we're trying to avoid. We're trying to avoid, going from inflammation to fraying to a tear. And creating good scapular stability is going to enable our athlete to get good upward rotation, keep the ball in the socket, and get good. And it's going to also help him not have to move around and adjust with his elbow, where we get elbow pain as well. It's basically they're shooting, when you have an unstable scapula, it's like, once again, I'm going to use the term, you're shooting a cannon from a canoe. If I had to tell you to long toss off a raft, you're not going to throw very far. If I put you on concrete, you're going to be solid on your lower half and you're going to go. And it's the same thing with the scapula and the ball and socket. Once you got a stable scapula that rides on that rib cage real nice and keeps the ball in the socket, we can perform and not worry about any kind of damage to the rotator cuff muscles or the labrum. If the scapula, like I said, if it's not sitting securely, then the individual strength of these muscles doesn't matter. And as I said, it's like trying to shoot a cannon from a canoe. Things like our SCAP series that we do. This is one exercise that we'll do, that we'll give our guys in our arm care program, where we'll take them, we'll do this exercise with their arms lower, and we'll hit mid, lower, and upper trapezius by using different positions. We'll go low, we'll go 90 like you see right here, and then we'll go at 45, and we'll have the athlete keep the feet on the ground to prevent any more lumbar extension that we get here. And we'll have him look down, so we're not actually creating any tightness in the neck while we're trying to actually work on scapular strength and stability. Improving the cuff of the strength of the rotator cuff. The importance here is that we ensure that each of the individual rotator cuff muscles are strong enough independently so they can contribute to overall shoulder health. Nothing happens in isolation. Okay, it's like a tent. You look at a tent, you got the tent up, all the spikes are in, everything's great, the tent's up. You pull one spike out, the tent's still up, but it's hanging in one side. That side, when there's rain, is going to leak. Okay, so when we're looking at health and strength of the rotator cuff, we need to focus on all four: the supraspinatus, the infraspinatus, the subscap, and the teres minor. And I don't want to really get into what these all do, but the supraspinatus is the beginning. It's starting from 30 and going above. The infraspinatus and the teres minor are more for external rotation and getting up, and the subscap acts more as a guard against any kind of, when they get into layback, humeral glide anteriorly that might prevent, but that might cause irritation in the front of the shoulder. One of the things we do is end range liftoffs. We put a half foam roller on the body, and we put it right across the anterior shoulder, so we can help the subscap maintain that ball and socket congruency and not migrate anteriorly, while the athlete tries to go into external rotation. And we'll do these for holds. If you want to know why he's got his head on his hand, it's because that will help us create a nice relaxed neck. We do not want to fire up upper traps and levator while we're trying to fix something here. We do not want to make something tight here. So putting the fist on the forearm is what we do to help that. Once again, just let me know when you have questions. I want to address the elbow because, quite honestly, a lot of the problems that come from the elbow stem from the shoulder, but not all of them. The elbow area is flooded with tendons and ligaments. It's probably the most traffic jammed area in the whole body. Okay, there's not a lot of room for error there. Okay, you've got a lot of stuff going on in here. So working on the flexor pronator mass, these are the first responders to the UCL. And making sure that you've got a good, strong flexor pronator mass is key. These muscles help stabilize and protect the elbow, especially when we kick into layback and that torque happens. These guys are key for keeping that elbow solid and stable. We have we call it a UCL circuit that we do in our arm care program. This is one of the drills, okay? Pronation, supination with a club. I think there's 4 or 5 exercises in the UCL circuit that we do to address the muscles that you saw right here. And this is one of them. Today I'm not trying to show you how to create your own arm care program. I'm just trying to show you what's involved. Thoracic spine mobility, T-spine mobility. So here is one of the #1 things that we see that is actually not shoulder or arm related. A lack of T-spine rotation can lead to a whole host of problems, such as limiting external rotation while laying back, internal rotation to help decelerate after ball release. It's huge. And it's the reason that you see some really tight and a lot of times really big and overweight pro guys throwing 100 miles an hour. They rotate really well. And by rotating really well, that will help you overcome a lot of other things that may be causing a problem if you can't rotate well. And oops, I don't have a slide for that. Quadruped T-spine mobility and bench T-spine mob. They're 2 of the drills that we do as far as what we use to create good T-spine extension and rotation. Band activations. So I just want to say one thing about bands. I love bands. Our guys use bands. Bands are 20, that's being gracious. Bands are 20% of our arm care program. I would say 10% of our arm care program. For some reason, people think that, bands can cure cancer. It's not the case here. The purpose of band activations is to help stabilize the shoulder, particularly the rotator cuff muscles, in order to prepare the arm to throw. Warm up, light resistance band work activates the muscles. It promotes blood flow, preparing the shoulder, and it's great as active recovery. Band exercises are great for active recovery to help that arm recover between outings, once again by promoting blood flow and stimulating the muscles. The one thing I do want to say about bands, we use them during the off season. We use them 2 times a week to help maintain that cuff activation and stability. Once high intent throwing slows down, right? But during the in season, we use them. Throwing is strength training for the cuff. Just throwing alone is strength training. I wanted to make a point here that banned exercises for pitchers should not be considered strength training. And I don't want people to think that you get your kid in there and you give him band work and you're giving him strength training for his arm. That's not the case. Band work is more of an activation. Band work is to get heat in there. Band work is to promote blood flow. Band work does a lot of great stuff. Strengthening your shoulder is not one of them. Okay. And that's just my personal thing. Don't think that you've got a 13 or 14-year-old kid who needs to put on 10 pounds of muscle and you're going to get that by doing band work. That's not going to happen. You're going to be in Mark's office really quickly. If you think that just doing band work is going to be enough to keep your young guy, out of the PT's office. So,
Nunzio, another question.
Go ahead.
Can you give an example of, let's say, 13, 14-year-old just getting to the big field, finishes up his day on the mound? These kids who were able to throw 6 innings on a 50-70 are lucky if they can throw 3 innings now for the amount of force and stress that's being created. Post, same day, post-game band work, post-game, what do you have your kids do?
So we have a post throw that we do. I'm going to get to the post throw in a minute.
Okay.
I will get to the post throw in a minute. I'm not going to give you everything that we do in our post throw, but I will tell you that if you haven't done band work before you throw, which I suggest you do before you throw, not after.
Okay.
We use rebounders. We use ball flips. We're actually trying to, we'll use lacrosse balls on the pec minor. We'll do all things that are trying to actually get that internal rotation that they've lost from throwing. We're going to try to get that back.
Okay.
You want to get back IR.
Yes.
They've been throwing, they've been kicking into ER, and what's happening is as you kick into ER, you're starting to lose IR. The range of motion is flipping back to front, just as it does in season. When we're in season, we gain all this ER and we lose all this IR. And by actually doing arm care in season, we won't lose so much IR because we're going to do our post throw stuff and we're going to do our arm care stuff that's going to help us not lose IR. Okay. But when I see guys that come in after they come in, they generally finish summer ball in August. They go on vacation. They walk in my facility in September and they've got ER and their IR is 15 degrees. That's not enough. We look for 38 degrees minimum. Okay. So it's getting back that IR after you throw, because think about it. If you throw on a Saturday and then you throw again on a Wednesday and you haven't gained back any of that IR, and you probably will gain back some naturally. If you've lost 10 degrees and you get 4 back, you're -6. Now you throw again and now you go back and now you start from -6. And now you're losing more. And
right.
it's expanding upon itself over the course of the whole season. And what you're trying to do with the arm care in season is you're trying to prevent that bleed into IR, and you want to actually keep giving yourself more IR. These are the kids that do the arm care in season. These are the guys that maintain their velo. Sometimes even their velo goes up. But they're not crying about arm pain. Their arms not hanging. And you know what I'm saying. So
thank you.
It's huge. But these are the band drills that we do. ER at 0 degrees, ER at 90 degrees, IR at 90 degrees, tricep pull downs and pronation rotation overhead, and retraction to low row. So what retraction to low row does is it teaches retraction, and then it keeps the scapula and the ball and socket congruency while the scapula retracts and glides on the rib cage. And we're trying to get this whole thing happening together with retraction to low row. All this stuff is in our arm care program. We sell the arm care program. You can get the arm care program if you come to our facility and train with us. If you if you come and you are on one of our teams, you're already getting this. If you're somebody who lives far away, you absolutely can email us, contact us, and we can send you an arm care program. You know, there's no shortage of resistance bands and activation bands. Over the years, we have refined them down to what we believe is the minimum or the maximum of what you should do. Okay. But unfortunately, so through social media and marketing, I want to repeat it one more time. People want you to believe that you are going to strengthen your arm by doing band work. If you're incredibly weak, anything will strengthen your arm. So yes, but only to a point, and it's not to the point that it's going to be durable enough to absorb the residual stress of a throw. So remember, let's be clear, resistance band work should not be considered strength training. So I'm going to touch on—
How often do you see like 13 to 15-year-olds come in with like those J bands? Like how often do you see that where they're like,
Okay,
oh, all I do is J bands and
right.
that's
And
my
this is
strength.
and Mark, this is an unbelievable question, and it opens up this discussion. If you have J bands and your kid is using J bands, they're going to want to use the heaviest J band there is because they think that more is better. And what ends up happening with a J band, if you use the heavy one, the normal one, this is the normal one. There's a junior band and there's a regular band. And everybody wants to use the regular band because that's what they see on social media. And when you get a young kid, and I'm going to be honest with you, when you get college guys trying to do external rotation at 90 degrees with a regular J band, they're pulling like this because it's too heavy. And what they're really doing is they're giving their lat a workout. They're not doing anything for strengthening and activating the rotator cuff muscles. So we don't even have the heavier J bands. We sell our own arm bands, and we made them lighter because honestly, if a guy needs more resistance, just step a foot back. If you step a foot back, it's going to be harder, right? But we don't use heavy bands with any guys. We don't use— I have Coastal Carolina, University of South Carolina. I have many Division I high-level schools that buy our bands, and they buy the bands because they don't want their guys doing this. And I've seen many 200-pound guys that are strong as oxes with 90 degrees. Those heavy bands, they're too heavy. Nobody should be using those bands, in my personal opinion. So that's where we're at with the band work. Yes, I see the kids coming in with Jaeger bands. I see and Alan Jaeger is a friend of mine, and he's a great guy. And I actually told him, Alan, I got to tell you, I tell everybody to use lighter bands, and he gets it. He understands it, but people have a tendency to go on Driveline and watch the retread guys and the older guys that are 250 and 26 years old using bigger bands, and they want to do what the big guys do, but they don't have the body like the big guys nor the strength, and then they start using all the wrong muscles to try to get this ball and socket congruency and activating their cuff. So great question. Strength training, the trapezius. I'm going to talk a little bit about strength training, and it's really going to only involve the serratus and the trapezius because these are the two things. This image right here that you see, for those of you who aren't in any sort of exercise science or PT, I want to explain to you how the scapula— this is the scapula, and this is the glenoid, and this is the glenoid fossa, and this is the humeral head. And we want this humeral head to sit on the end of this scapula. But we look for 55 to 65 degrees of upward rotation when a guy attempts to go overhead. Okay. That requires the upper trapezius to pull this way while the lower trap is pulling down and the serratus anterior is pulling to the front. Okay. And what this does is this helps get the scapula up and around. Okay. And that is what we're looking for to get the arm to the position of layback successfully with good ball and socket congruency. So we really need to work on the upper portion of our trapezius, the middle portion of our trapezius, and the lower portion of our trapezius. The other muscle, like I said, is the serratus. Its action is to pull the scapula forward and around the rib cage, protraction. Okay, basically, it pulls your shoulder blades apart. It also holds the scapula against our rib cage. Okay, and it's important to pull for the scapula to remain on the rib cage because it glides better when it's got a nice base, stable base of support on the ribs. If we have a weak serratus, we will see winging. The bottom will tip up, the interior will tip up, and we'll start to see dyskinesia. So that's winging. And that's something that we look for. If the serratus is weak, we can sometimes see what is referred to as winging, like I said, from the rib cage, creating suboptimal movement. So we use wall slides. There's a lot of drills that we use to actually work serratus. We can use things like hand switches. We'll use scapular push-ups. We'll use wall slides. There's a ton of them. And they're all in our strength training programs as well as our arm care program. Recovery and post-throw. So here we are. Pre-throwing. Many pitchers at all levels simply don't perform their arm care programs properly. I even see it in our facility. I see guys walk in. I'm like, guys, I just watched you walk in here 5 minutes ago, and you've already got the plyo balls in your hand, and you're throwing them against the wall. I'm like, what happened to all the arm care? And we will scope guys out, and we will tell them, yo, go back and do your arm care. It's something that guys don't like to do. As they get older and they realize and they become a little more mature and they realize the importance of it, it's something that they will do. Post throw, many pitchers aren't aware that a post throwing program, like you were saying, Jim, and recovery protocol is just as important as the pre-throw routine. Post-throwing routines can be performed in 20 minutes, even 15 minutes, with the primary purpose of restoring lost mobility during the outing. It's getting that IR back. Okay, that's what we're talking about. Part of our arm care program, when you get it, if you were to sign up for it and have it sent to you, part of it is a pre and post throw. The pre and post throw is the final piece of the puzzle when it comes to taking care of our arm and our elbow and our shoulder. So that's where we're at. I'm going to open it up to questions right now, to anybody that has questions. Like I said, these are.
Nunzio, could you hear me?
Yes, I can.
Hi, this is Neil Iavero. I'm the baseball coach at Kane, so I'm pretty local with you in Paramus.
Hey, man.
And how are you? Good to see you.
Nice to see you.
So, all right. So I want to ask you a couple of questions, if that's okay. So,
Sure.
and feel free to correct me if I'm saying this the wrong way or it's coming out in a different way than it actually happens. But I have access to a lot of high-level therapists and research scientists and some strength human performance coaches in the big leagues. Like I have, thank God, access to that. So I was told years ago that they tested the UCL ligament, right, when they took a cadaver and they started pulling it apart, and they realized at a certain level of force that force snapped the ligament. Okay, and
I think it's 35 newtons. I think it is.
Yeah, it's like some Newton meters of force. And I think when they tested the high level college pitcher, the high level minor league pitcher, obviously the big league pitcher, they said that those forces that are being thrown on that UCL are higher than the force that it takes to snap the ligament. So in all my years of doing pitching stuff, that like floored me, right? Because that literally means you should be tearing that ligament every single pitch you throw at the force you're creating. So then obviously you're not tearing it every single time. So it turns out that, after doing the research, all these muscles in the forearm, all those flexor, right, that's aiding in taking the stress off the UCL.
They are the first, like I said, they're the first responders to the UCL.
Okay, so now I have to try to equate things to my guys in layman's terms so they understand, they'll understand things better. So what I equate some of this stuff to is like if you have a boxer and they have the boxing gloves on, like inside those gloves, they're not squeezing their fist as tight as they can and throwing punches. Their hands are loose inside that glove. And as they're throwing their punch, at the point of contact, everything will naturally tighten up. And I think that increases hand speed because when you're really squeezing, it's going to make things stiff and you're not going to be able to move as efficient when your whole, arm is tightened up at a max capacity. So relating that to the pitching side, right? I know a lot of the places that do arm care and do the plyo ball, everyone's talking about squeezing the hell out of the ball.
Not me.
Okay. And I'm actually teaching them to hold it as loose as possible. I want to see that wrist move real loose. I want the ball jumping it because I know at the point of release, naturally the hand's going to tighten up. But if you take that ball and you squeeze, I mean, they're holding this ball like rocks in their hand, like squeezing the living hell out of it. And so if you just take any ball and just squeeze it as hard as you can, you start to feel those muscles in your forearm and those tendons just get fatigued and they really start to, die out, sooner than they probably should. And I think, some of these plyo balls most of them have compression, right? So these kids get their fingers into the ball and compress the hell out of it. And I think the newer plyo balls don't have a compression in them, which I think at least alleviates some of that squeezing. So what I'd like to know is from you is what is a good way to go about that to take the fatigue off the forearm? Because
Okay.
how I equate it to a lot of these injuries, I say you're giving a person an exercise. Every exercise they do is a 1 rep max. I'm going to do your bench press as much as you can. Everyone's thrown with such a max force and stressing the body out so much. And eventually something's got to give. So can you give me some stuff and cues that I can to try to get that to alleviate a little bit?
Okay, so that's an unbelievably great question. Okay, so number one is we do use where did you go? Oh, you're over there. Okay, there you go. Okay, so we do use more compressed plyo balls, number one, for that reason. And I would say probably about 6 or 7 years ago, we noticed when we started remapping the throw and we were using the regular plyo balls, we did start noticing that kids were getting forearm tightness and elbow tightness when they were throwing the plyo balls. And we realized it because for the simple reason that they were squeezing it too hard. What we do now is we use weighted, when we go to a 4 ounce or a 6 ounce or a 7 ounce ball, we use weighted baseballs for the simple reason that you can't squeeze them.
Right.
Okay. That's number one. Number two, what you're talking about is the same reason that I can't stand weighted ball holds. Okay. So what you see a lot of people do is the towel drill, or you'll see guys holding weighted balls and throw and not letting them go. Okay, they're throwing the ball and they think because they have the weighted ball in their hand, they have to decelerate, and they're strengthening the posterior cuff because they still got the ball in their hand. But what happens is when the brain knows that the hand's not going to let go of the ball, it changes the arthrokinematics of the joint, and it makes the actual mechanics and delivery of that throw different and unnatural than what it really is. And what we do, and what you might want to investigate, is there's a throwing sock that my buddy Randy Sullivan uses all the time. And the great thing about this throwing sock is exactly the boxer comparison that you made. When you put a throwing sock on your hand and you drop the ball into the throwing sock, right? And you put a 6 ounce ball in that throwing sock. Now you can actually, what we tell them is pull the ball 4 inches away from the sock and strap the sock on. Now we've got space in between the hand and the sock. And what happens is we have them go through their entire delivery, and now they're letting go of the ball. So now they can go through their actual mechanics and let go of the ball, and it doesn't affect the kinematics of the joint because the brain knows it's letting go of the ball. But
Right.
what happens is they let go of the ball, and because they let go of the ball, everything is more relaxed, but they still have the weight of the ball in the glove to strengthen the posterior cuff. So it's doing what the weighted ball hold does, but it's allowing them to let go of the ball. And not only that, but we tell them, if you throw the ball and you don't hear a pop of it going into the end of the glove, that means you were releasing early. If they're releasing up here, they're not going to hear the pop. If they get out front, late ball speed, and they hear it, so it's almost like a coach for them to know if they're releasing early, as well as giving them strengthening the posterior cuff and doing their weighted ball holds. That's kind of like what you're talking about, right?
Yeah, just something to, like, in their minds, they just believe they have to squeeze even on breaking balls. Like, to me, you can't spin the ball if you're squeezing the hell out of it.
You
Your
can't.
wrist and fingers have to work to spin the ball. It just doesn't do what you want it to do because you're squeezing it. And like, but like I'm constantly walking around while they're throwing and just grabbing the ball out of their hand to see how tight it is, and their wrist is locked up. Their
Yep.
and one of my friends who's a high level person like you, they did this grip test with us where, like, a kid literally, they did the grip strength test. He got on the mound to throw. He came off the mound. They grip tested again. Each inning, they're losing a certain amount of grip strength.
100%.
Trying to see at what point. And you might even know the guy. It's Dr. Mike Mulaney. I don't know if you know that name, but
No.
he think he knows you. But and so it was constant loss of the strength in the grip as each inning went by. And it's just showing you, like, there's constant fatigue going on. And I think a lot of this is created by just simply pre-pitch how they're holding this ball. Because if you squeeze anything and keep holding it, it's going to fatigue those muscles. And it's so hard to get across to the kids, because when they go to these other places where some guy just got a program and he just put it together off what's on the paper, they don't know
Yeah.
what they're doing.
Yeah.
And so
Weighted
it's
ball,
being relayed to them
those
a
weighted
different
ball
way.
plyo programs, there is that we discovered the problem of kids over squeezing the ball simply by kids telling us, once we started more mound velo with our plyo balls, we started realizing that kids, once they had to start throwing a little harder with these plyo balls, they were gripping them because they knew they were going to throw them harder, and we bailed. We actually started using, just instead of a 6-ounce plyo ball, we're throwing a 6-ounce weighted ball into a net. And they have a tendency to not be able to squeeze it as much because there's no give.
Right. And then can I ask you one more real quick?
Sure. Great questions.
Okay. So when you think about the long tossing that goes on, right? So there's certain ways that we want to go about it from start to finish. And the people are starting at a certain point, right? We want to keep working our way out. I want their arm like a wet noodle, just on the way out, just really staying loose and relax. And eventually you're going to hit a point where it's not that easy to reach the person. Okay.
Right.
And so you're going to have to get your lower body involved. You're going to have to get either a back step, or some people like to hop, or whatever term you want to use. They're going to have to get their lower half involved more to start to reach. So now, as pitchers, right, we're constantly being taught to throw the ball down with the downward plane. So we got that force coming down the mound, and we're being taught to drive the ball down. That illusion of high to low, from like release point to at somebody's knees to below, is a tough, ball to hit for that hitter. And so you're emphasizing that downward plane all the time. Well, if you think about the concept, when you long toss and you start getting into those distances, eventually one of us, like if me and you were playing catch, one of us would not be able to reach the other at a certain point. And so now you'll start to see either, right, they're going to go throw that, they're going to dip that shoulder, the ball's going to go up in the air straight. And when you throw uphill like that, that's terrible for your shoulder. And so you're losing the mechanics. Number one, you don't throw any ball that way in the game off the mound. Number two, you're putting your shoulder in a very difficult position to have to throw upward. I mean, that impinges that just getting it overhead at that level is stressful. And so eventually it's just being heaved up there. So the normal mechanics of just moving your feet, having a nice long, easy, arm slot, and trying to elongate on the way out with the arm and get a good finish, that goes out the window. Now it's, can I keep up with the partner and throw this thing 200, 250, 300 feet? And so, in my opinion, this is just my humble opinion, I don't even think you need to long toss, in the sense that I think that is counterproductive if we're going to have to throw it like that. And I'll make the case that I think you can get inside a batting cage and literally throw the ball into the net using perfect mechanics. Because if you are throwing with your normal mechanics, with a good arm slot like you normally would pitch out of, that to me is better. I'm still releasing it, quick, and I'm getting my arm to move, but I'm not getting my arm in those weird positions. So sometimes I'll have them throw like into a divider in the gym, like just throw it into divider, pick it, guys are picking the ball up and giving it back to them. So I'd like to know from your opinion, because I know some of the pro teams have literally stopped throwing on flat ground, period. There's no more flat ground throwing besides simple catch. When it's time to throw to a catcher or anything else, that it's got to be off the mound, even if it's light at 45 feet. What could you tell me about what's going on that long toss when they start doing those bad mechanics, and how that could hinder? Because they're going max effort. For you to reach at 250 feet to 300 feet, you got to be putting a lot of max effort into that throw to get it to go that distance.
Well, if they're long tossing, and the athlete, for us, we do connected long toss. We do a drill where they're throwing at 50 feet. If you make 3 where the guy doesn't have 5, where the guy doesn't have to move more than from side to side to catch the ball, then you can move back. And then once you can move back, we'll do maybe a walking torque where we walk and we do another drill, because he has to throw it further, and we give him a little bit of a walk and he throws. Once again, if he can't throw that ball with accuracy into the player, then he's going to stay there. And then once that happens, then we'll do maybe a shuffle toss and we'll move him back further. But once accuracy starts to go away, it's shut down. We're not really concerned if a guy can launch a ball 300 feet if it's not going where it's supposed to go.
Right.
And also if he's using bad mechanics to do it. So I kind of agree with you. Also, another great thing we do is when our guys, when in the winter, when we indoor long toss, your statement about flat grounds. When we throw flat grounds, let me just figure out how I can explain this. We try to emulate the front foot having more time on a slope to actually externally rotate. Okay. So we have a guy throw, and then we put a mark 2 to 3 inches over, and we want him to actually, when he's throwing flat ground, we want him to actually move his front leg 3 inches over more than he normally would on a flat ground where he's naturally landing, to compensate for the extra time that he gets when he's throwing down a mound. And the reason a lot of pro guys stop throwing flat grounds is because of the lead leg hits early, because it's actually doesn't have the time of the slope. So when you throw flat grounds, you are landing a little more closed than you would naturally land when you throw. So what happens is that causes an early collision with the shoulder. And I believe that flat ground throwing is not great for the shoulder because of that. So if you can move the pitcher's front foot over 3 inches to compensate for that time on the mound and let him go, it gives the arm more time, like it would on the slope, and you can get away with throwing flat grounds without the damage that gets done to the shoulder. Because I agree with you, as far as flat grounds go, if you don't do it that way, the arm is landing early. You're creating a more provocative position in the shoulder and the elbow with the arm when they're landing flat ground, because they're hitting the floor early. They're hitting the ground early, right?
And you're going to get better hip clearance from the backside by opening up a little bit more.
Exactly.
Right?
So we open up 2 to 3 inches to make it where it would be on a mound, and we can still throw flat grounds. And as far as the long toss goes, I love long toss. I believe that it's great for the arm, as long as it's not being taken advantage of, like you're speaking about. And the way we do that is to make sure if you're not hitting your marks, the distance is too far.
Yeah, if I can,
So you want to be, yeah, go ahead. I'm sorry.
no, that's okay, Neil. If I can comment, and it's with the younger kids, 10, 11, 12-year-olds, and not extreme long toss or anything of that nature, but, and to your point, Nunzio, making sure they're hitting their targets. What I find is helpful with long toss in general is the younger players they have to move faster. So once they start moving faster, what I see is when I video them, their body organizes a heck of a lot better and their mechanics just clean up. Where I'll have dads come in and are like, oh, my son throws like a girl. And I'm like, well, I know some girls who throw really, really well, so I don't know what that means. Right. But then I asked them, well, show me your throwing routine. And it's, the old flip of the wrist and play and catch from 10 feet away. And I'm like, okay. So we get them warmed up, and I'll roll them a ball, and I'll say, listen, pretend you're in center field and you need to throw this home. And I video them, and they look like a completely different kid. So that's where I incorporate it. And it doesn't necessarily have to be long toss, and it's not even running guns, but it's getting them to move faster.
Yes, taking time and tension out of the throw.
Yes. Yeah, 100%. Yep. And that seems to work really well. And I do see it also in 13 and 14-year-olds, those stiff moving kids who, somebody in Little League or dad's been telling them to throw over the top. You got to have a high arm slot, and they're not a natural arm slot kid. And you just let them move, and their movements clean up just because they're moving faster.
And that throwing like a girl, that's basically someone saying that they're pushing the ball, because
Yeah, exactly.
what's happening is, back in the day when girls didn't play sports, they didn't have a lot of external rotation. So they used to push the ball because they couldn't get layback. And that's where that term came from, right? So when you see somebody that's throwing like a girl, they generally don't have a lot of layback, and they're pushing the ball.
Sure.
The other thing is taking time and tension out of the throw for young kids is a huge thing. And it's why we see shortstops who throw at 90 miles an hour and 88 miles an hour never have arm pain, because they have to pick the ball up and they have to get it to first base, and they have to find the quickest, most efficient path to get this ball to first base. And what happens with a lot of pitchers is there is no time constraint on their windup. And
Right.
a lot of times that time will give them a lot of time to get into trouble posturally.
Yes.
And
Well,
that's a really great point.
yeah, because if you watch, I follow a lot of the NPA stuff too, and I like a lot of the NPA stuff in terms of, front foot down in 1.05 or whatever, head and eyes level, those type of things. And if you watch, you get on YouTube and you put in top MLB shortstop plays, and these guys are rolling through, and their head and eyes are level, their arm slot is natural, their foot gets down early, and they just move like athletes. And it drives me crazy when I'll go over to a Little League practice and coaches have kids stalling at the top, moving super slow because they're worried about them throwing strikes, when what I think they should be doing is turning them into athletes and have them move faster.
100%. I can't stand the drill where guys come up, they land, and they have them freeze there with their foot.
It's terrible.
It's like, that's the most unnatural thing I've ever seen. It's like,
It makes no sense.
You don't throw like that.
No.
It's just like,
So-
yeah. Time and tension, taking time and tension out of the throws, key. Anybody else?
And then
Yeah, go ahead,
Nunzio, what
Jim.
could you
Go ahead,
tell? What could you tell us about like like, because obviously the UCL, right? When that thing tears, the kids go, they have their surgery, they finally get to doing their arm care stuff. Like now, all of a sudden, that thing's strong again. It could have been strong before the injury happened, and they wouldn't have had to go through that. So that injury can be fixed, and guys can come back. What we're seeing is obviously the labrum's a whole different ball game. Like that labrum is getting,
That's a whole different
torn. It's
story.
a
That's
tough
a whole different
surgery.
story. Yeah.
But what kind of stuff is causing these labrum issues? Like, is it certain type of arm slots? Is it like,
So
is it the front foot landing too early and then the arm's still not in position and there's got to be an extra movement out of the shoulder that gets that thing going? And that, like, what's causing these labrum injuries?
what I find is the biggest thing that creates posterior labral, like slap tears and posterior labral issues, is athletes who do not pronate well. Okay, so what happens is the bicep tendon comes through and it connects to the posterior labrum. It attaches to the posterior labrum. Okay, and when you throw and you pronate, if I pronate, you can see my tricep turn on. If I supinate, you can see my bicep turn. Okay, so when you're in layback and you're coming through, you're in supination. As you pronate, look what happens to my bicep. It relaxes. Okay, so as you throw, if you do not pronate enough, the bicep tendon stays engaged through the entire throw, and it starts to pull on the posterior labrum. Okay, and I find that that's the number one thing that causes labral issues, other than trauma like falling. We're not talking about that, but
Right.
throwing and not fully pronating and keeping this bicep 3/4 engaged as you're going through extension, it's pulling on the labrum. So getting them to pronate, which is another reason that I love that throwing sock, because what happens is when you let go of the ball and it pops into the end of the glove, it forces pronation. And what it does is it forces the tricep to turn on and the bicep to shut down. And we want that bicep to shut down so it doesn't stay on fire and pull on the posterior labrum. And I find that keeping the bicep engaged from not pronating is the number one thing that actually starts to irritate the labrum.
You
So
hit
would
that right
you,
on the head. That labrum is like, once you have that, if you don't pronate, you have that forceful contraction of the bicep, which then pulls on the labrum, which causes that slap tear. From
Absolutely.
my standpoint,
Absolutely.
so would you, if a kid is complaining of, bicep discomfort after throwing, maybe one of the first things to do, slow motion video and see if they're, staying
Pronating.
in see if they're staying in supination, and then work on them pronating more.
Yes, and I would
Yeah.
encourage everyone to get a throwing sock, because I would not feel right about saying anything tonight without telling you that when I get guys with elbow pain, when I get guys with bicep pain, when I get guys with tricep pain, and then I have them throw in a sock and I have them do 15 throws with a sock, I would say probably 75% of the time it doesn't bother them. And then they take the sock off and they throw again and it bothers them. So what ends up happening is we like our guys to throw 10 throws with the sock, go through their bullpen. When they're done, 10 more throws with the sock and get out of Dodge.
Okay.
and
Get,
and back to your point, Neil. The UCL from our standpoint tears at like 32 to 34 Newton meters. But when you have that varus on that external rotation in like late cocking phase, we say like you have almost 100 Newton meters of force pulling down on that elbow. So that's when like when you're talking about the grip, I loved your point, because if you have a tight muscle there, that's going to cause so many more problems, because you're not going to have that fluid motion of your muscles around your elbow joint, causing that labrum, especially when you have about 60 pounds of force pulling down into more external in that late cocking. So I agree. I think the squishy balls are just not it.
yeah, we got rid of them. We use weighted balls. We use weighted baseballs at this point because there's just too much play there.
And then
This is
I don't know if doing this intentionally, but when you were demonstrating that thing with your arm, your fingers were facing more towards your ear, okay, versus having your finger like this. You see how you have it like that?
yes.
So I'm wondering is wrist positioning, because if you take the ball out and the ball's supposed to be facing, behind you, and then you start to turn, you start to see the fat part of the wrist. I'm doing this in a dark car. I don't know if you could see this, but I have a lot of kids, right, that they're trying to throw a breaking ball with this bent wrist, okay, which is locking you up. You can't use your fingers and wrist anymore with a bent wrist. And even some of their fastballs are in this position on their rotation. So now, is that alone something to look at, where these fingers are coming towards the in here? I want their hands out. I want to create leverage coming out with their hand versus cocking it in here. Is that something to look for that can cause that, what you're talking about?
Um, I I kind of can't answer. That's more of a question that probably my pitching coaches could answer. But I will tell you that just
Like
being
the grip you have right now, you're throwing a curveball, is what I'm saying. So if you show me your palm,
yeah,
that would be your fastball change,
right,
right? Turn your wrist a little bit, your slider goes. You turn the wrist completely. That's a curveball you're throwing right now.
right.
When
And
that wrist, yeah.
I
So I'm
feel,
just
I feel the bicep more
right. Okay.
now.
But some kids are constantly in here with every pitch is the point. They're just
Right,
locked up with that wrist
right.
curled, and that's
I
so
think
that
what
could.
I absolutely, I agree with you 100%. But the point I'm trying to make is when we actually start to create force and acceleration through the acceleration phase, and when we're coming down and we don't pronate enough to actually let the arm decelerate, to me, that's where the problem lies.
And could some of that be because most kids, right? They want to put. Everybody wants to push, and there's more muscles in the front that speed it up versus muscles that slow it down, and those muscles are weaker. So could the back muscles be saying, "Hey, you can't go too fast. I got to slow you down," and like that
It
imbalance is causing that?
it could be, but I have a tendency to believe that kids who don't have a lower half, kids who don't know how to use their lower half, they start to actually get tense up here because everything starts to have to come from their arm. Okay. But
Right.
when you get a guy with a good lower half and he lets the hips deliver the arm, right? That becomes like what you were talking about, that really elastic, loose arm, right? So you see less kids with labral issues that know how to use their lower half than kids who don't use their lower half and they're getting half their velo up top. You agree with me
Okay, that
on
makes
that,
sense. Yep.
Mark?
Yep. Yeah, that makes sense.
Yeah. So that's that's using your lower half, but it's hard with lower kids, with young kids. They don't even realize they have a lower half yet. You know what I mean? So we really need to promote kids to get strong, and like Jim said, really just get more athletic. I think creating better athletes is the key to creating guys who can throw harder for longer without getting injured.
100%.
That's what I believe,
Yeah.
honestly. And I think that I watch it, and people always say, "Wow, my kid came here and his velo went up, and his arm never hurts." Well, I have great strength. I have great pitching coaches, but I have to tell you, it's because we make them lift. We make them lift. We make them do plyometrics. We make them do med ball work. We make them rotate. We make them jump. We make them sprint. It's like you have to do all this, and then they're just better athletes. And then you get the kid who's his dad wants him to just play baseball all year and not play anything else. You know what I mean? And then what ends up happening is you get these repetitive use injuries, and you get a kid who starts to lose his lower half. Like at the end, I can see the kids that I go in the in season, I go visit some of my guys, and I can see a kid who's getting in trouble because the first thing that happens is they lose their lower half and they start to throw high and arm side. And that's what starts to happen because they can't hang on to the ball anymore. Once the lower half doesn't have it anymore, and once the core is weak and they're getting tired throughout the course of the season because they haven't been coming in 2 to 3 times a week to lift, what ends up happening is the brain says, we ain't got this anymore. And then when he ain't got this anymore, it tells you to let go of the ball because you ain't got it anymore. So now you're releasing from here instead of here. What also happens is you lose leverage on the ball because now you can't spin the ball because you're spinning it from up here instead of letting the arm come down and get out front and spin more. Now you're losing vertical break on your curve ball, and all of a sudden a kid's never going to tell you that his arm hurts, and what he's going to do is he's going to try to make that up by arming the ball. And the first thing you should see is high and arm side, because once you see high and arm side, then you will see velocity drop, and then you will see arm pain. That's from a kid losing his athleticism by continuing to not work out while he's playing baseball.
Yeah, but the 14-year-old PBR championship is important.
Yeah, let me go showcase myself off the list.
Exactly.
No, and for me, I literally have boy-girl twins that are about to turn 12, and my daughter has played baseball and never played softball, and she's actually pretty, really good, and it's funny how you said throw like a girl. And pitching's what I've done my entire life. I haven't had them pitch yet. I refuse to let them pitch simply because I know they can't execute the right movements to get their body in the right spot to move.
Good for you.
But
Yeah.
and I'm dealing with kids. This is insanity. Like I tell, I'm somebody who I think you can pitch a long amount of distance in terms of volume of pitches. As long I'm judging the amount of pitches that constitutes a long inning, and then are you physically in shape and trained for the mission you're going out there? So we judge 15 pitches or less as a complete inning. So anytime you're at a 20 pitch inning, 22, we're taking an inning off the back end. So if you go out there in the first and you throw 20 pitch innings, you're not going 9 innings anymore. You're down to 8.
Right.
And we just keep condensing the game based upon these numbers. And so with these kids, when they're weak, then your body falls apart. But if you're strong and if you keep that pitch count in line. So I try to tell these parents, you're better off having him throw 50, 60 pitches and leave him alone for 5-6 days than having him throw 1 inning on Friday. He only threw 1 inning Saturday morning and 1 inning at night Saturday. And then Sunday, he only threw 2. And
he's
you interrupted this kid.
And he's not getting used to the residual stress of throwing. You're ending it too early.
His recovery mode.
Yes,
you interrupted his recovery mode every single time he did that. Like they don't get it. And I don't even have my own kids pitching, and they still don't understand it. Like
right.
I won't let them do it. Like they're not ready for it yet.
Absolutely. Hey man, guys, this has been great. And all of you, anybody that wants to reach out to me, my email is nunzio@rocklandpeakperformance.com, and I would love to hear from you guys. Guys, Neil, Jim, Mark, email me, call me, get in touch with me. I'll give you my phone number. Love to talk to you guys. This was one of my favorite Zoom presentations because it was great information from all you guys. So once again, I have an arm care program that I can give you guys. I also have plyometric training. My facility is Rockland Peak Performance. You can reach the facility at rocklandpeakperformance.com. You can reach me on Twitter at Nunzio Signore. Please get in touch with me. I love talking to you guys. This was
maybe I'll take a ride up there if you don't mind. I'm so close. I can come see you if you want.
100%. 100%. I'll show you around the facility. I love, breaking bread with guys like this. And I'll speak to you all soon. And I'm going to stop sharing for a second here. Great. And any more questions, just feel free to email me. Once again, nunzio@rocklandpeakperformance.com. I will drop your phone number. I'll be more than happy to give you a buzz. Thank you.
God bless you guys.
Everybody.
You're awesome, Nunzio. Thank you. God bless you guys.
Thank you, everybody. Have a great day.
Have a great night. Thanks,
All right
guys.
now. Bye-bye.
Thank you.
All right.